Hey everyone, Dr. James Stirrett here. Today we're going to be talking about Semaglutide, the GLP-1 agonist drug that everyone's talking about these days. Some people love it, some people hate it, but we're going to be talking today about the 3 hacks that I use in my practice with my patients that are currently on Semaglutide to maximize weight loss while also prevent some of these nasty side effects that people are criticizing Semaglutide for. And so let's jump right into it. So for starters, what exactly is Semaglutide? So this is a drug, it's an injection that's done once a week, typically 1 to 2 times a week. And what it does is it makes insulin receptors more sensitive. If you're unaware of what insulin is, it's the hormone that our body produces to tell our body to reabsorb sugar or glucose in the bloodstream. And what insulin resistance means is that the body is, as it's exposed to more and more sugar, the body has to produce more and more insulin because those receptors get fatigued. And this is how people develop type 2 diabetes and metabolic syndrome, and which we care about because we know that this causes cardiovascular problems in people and reduces life expectancy. We really want to concentrate on this when it comes to these GLP-1 reducing drugs like Semaglutide, Wegovy, Ozempic. They're all the same drug. They all target this GLP-1 receptor, and we're able to make these receptors more sensitive so your body does not have to produce as much insulin as it once did. So it helps to reverse insulin resistance. So what are some of these side effects? A lot of people have mentioned, oh my gosh, Dr. Stirrett, there's so many side effects when I Google Semaglutide, and there's only really a handful of side effects that I actually see in practice. I'm not saying that it's not possible to experience other things, but typically it's nausea and just people flat out not being hungry enough. And along with that, constipation. So what's happening with Semaglutide is it has this effect of delaying gastric emptying, which means it's slowing down the rate at which food moves through the digestive tract. So if you're somebody that suffers from constipation, you really need to pay attention to this if you're going to start Semaglutide, because it's likely going to slow things down even more. We're going to be talking about how to mitigate this later and how to ensure that this does not happen to you. I just want to point out that a lot of my colleagues out there are totally against GLP-1 drugs. As a naturopathic doctor, we're like, oh, take herbs, take supplements, fix your diet, be disciplined. But as a naturopathic doctor, I also realize that a lot of people get stuck in life, and they get stuck in the stress of life and their patterns of eating, and sometimes they really need something that's going to help them disrupt their pattern. And there are people that challenge this drug as saying that it's unsafe. But I would argue very strongly that this medication, not only has it been studied to not cause a lot of these things that have claimed to be like pancreatitis and people whiplashing their weight back, all of these side effects and negative things that are associated with this drug are really determined by how you use the drug itself. And that comes down to how the provider treats you at the end of the day. You know, if you get put on a large dosage of the medication and you're just left alone for a year at a time, then no, this is probably not the right approach at all. And as a naturopathic doctor, I would say, well, you need to pump the brakes on that. However, when used appropriately, this drug can be used as a tool so you can be weaned on and weaned off, and something that's going to help increase motivation for you so you start seeing results and you start feeling motivated to make the dietary changes that are needed to maintain the weight loss that you're seeing. Now, are there some risks associated with this drug? Yes, of course there are. We don't want to give this to anybody, with active thyroid cancer, medullary thyroid cancer, other more serious illnesses. Those need to be screened for prior to you starting the medication. I always tell people, look, if your doctor's not asking you about your medical history and they're just putting you on Semaglutide, that's insane. You can't do that. Beyond that, we really need to check blood work prior to starting. I prefer functional labs where we're looking at all of your different hormones, all of your inflammatory markers, basically everything that could be contributing to metabolic syndrome, contributing to hormone dysregulation. We want to check for these things initially so we can really build you a great plan around weight loss and make sure that we're filling in those gaps and optimizing those things prior to starting you on a medication like this. You don't want to be swimming upstream, injecting a medication to help you lose weight, and then there's like 20 other things that are going wrong that are holding you back. And you're going to just end up wondering why, like, oh man, I guess it just doesn't work for me. I guess I'm just broken. When no, you just didn't have somebody that was looking at the full picture. And without any further ado, hack number 1 for using semaglutide is the golden secret is going to be fiber. If you are not consuming enough fiber, you're going to have big problems. So let's go back. Take one step back. This medication slows down the GI tract, right? If you're somebody that struggles with constipation, you're going to have a problem when you start this med. So what I recommend to do is start taking fiber immediately. I also love a good probiotic and drinking enough water. Those are separate outside of this realm, but I would definitely add those in with enough fiber. My favorite fiber to add in is psyllium husk fiber. Just simply add 1 tablespoon per day, 1 to 2 tablespoons per day, and that is usually enough to smooth things along, coax along the bowel, because one of the things that you really need for maximum weight loss is good detoxification and elimination. So if you're not detoxifying, or if you're not eliminating, meaning you're not going to the bathroom every day, what it means is you're not detoxifying these toxins that are going to build up in the bloodstream and create a lot of problems when it comes to weight loss. Whereas if you're constantly eliminating, we don't want to overdo it, but going to the bathroom 2, 3, maybe 3 times a day, having a healthy bowel movement schedule, you're going to be able to offload toxins, and this is going to really, really facilitate the weight loss process. You're going to be able to lose weight faster under this scenario. Next, number 2 is going to be diet. We have to focus on our diet when we're on semaglutide. You can't just inject it and hope for the best. What's going to happen is you're going to lose a little bit of weight. It's going to be super slow. You're going to be like, oh yeah, this drug, it works pretty good, but I wish I could see better progress. This is the consistent thing that I see. Patients on this drug for like 3 months, and they're like, yeah, I've lost like 5 or 6 pounds. It's going pretty well. And I'm like, 5 or 6 pounds in 3 months? That you should be like way beyond that. My clients usually lose 5 pounds in the first week because what we're doing is we're eliminating water weight first. Water weight is the equivalent to inflammation. Diet is what causes inflammation within the digestive tract and the rest of our body. So what I tend to have patients do is we want to avoid inflammatory foods, avoid things like dairy, and avoid things like nightshade vegetables, avoid things like legumes. These are usually the 3 categories of foods I won't go into too much that do cause a degree of inflammation in the body for most people. Again, there's no such thing as a one-size-fits-all approach. However, I do think you should be armed with the information. Take things one step deeper here. That's just from the weight loss perspective. Now, from the side effect profile, what happens with semaglutide? People have this tendency for nausea. With nausea, it's typically only 1 if the dosage is too high, but more so 2 if you're eating too many fatty foods, if you're drinking alcohol, if you're eating like burgers and fries and pizza and cheese, if you're eating a bunch of crappy food and wings, and if you're going to the bar and having these foods and you're on semaglutide, it's like, what are you even doing? Okay, I mean, I totally get it. Like, we ought to live here and there, but if you're consistently doing that, you're going to be nauseous the entire time you're on this drug. There's just no way around it. And the last magic hack I have for you, number 3, is going to be your dosage. So many providers look out there, they're just going off of what the medication says online or on blogs, or what these weekend-long trainings for semaglutide tell weight loss providers to do, which is essentially start with 0.25 milligrams of semaglutide for 2 to 4 weeks, and then basically start doubling it. Every 4 weeks, you're essentially doubling the medication until you're getting them up to like 0.75 to 1 full milligram or more. If you're a diabetic, you might need to be on dosages like this, which is just fine. And I'm not knocking you if you're diabetic. Most people that come to me are not diabetic yet. They're usually like, they have insulin resistance, which is different, meaning that their body is leaning towards diabetes, or they're pre-diabetic. In any case, we need to actually be able to look at the person and say, what is the right dosage for you? Where do we start? And as a naturopathic doctor, I like to start with the lowest force intervention and see how people respond. And you might be like, wait a minute, what does that even mean? Well, that means for me, I like to start at 0.125 milligrams. And this can all be achieved within a small insulin syringe. You might be thinking, how is that enough of the medication to actually stimulate an effect in the body? And my answer to that would be, you would be shocked at how many people I start on this medication, and we don't even have to increase the dosage because they're losing 2 to 4 pounds a week when paired with diet, when paired with fiber, when they're receiving coaching from myself and my team. This dosage tends to be perfect. We might increase it a little bit. The key is there to then start spreading it out. Instead of just doubling your injection 1 day a week, I like to spread the dosages out. If it's 12.5 units, I prefer to do that twice a week instead of bumping that up to 0.25 milligrams. That has a great effect on clients because it's giving them more consistent access to that medication within their body throughout the week. It is decreasing the likelihood of side effects. Side effects typically happen with dosage increases, I've noticed. After doing this with a couple hundred patients now, I totally understand what's going on. When we increase the dosage, we increase that side effect profile. However, if we're spreading it out throughout the week, typically not at all or not to the same degree as if you increase it all on the same day. So I hope that is helpful for you. I know this has been something that's been so helpful for so many of my patients. I've seen people with drastic weight change. And let me leave you with this last question, okay? What about when you come off the med? Are you just going to gain it all back? And I'll tell you right now, from my experience, no, that is not the case. From the research that has been done, no, that is not the case. Although, if you add back in a poor lifestyle with not working out and a bunch of junk food, of course you're going to gain weight back. Of course the insulin resistance is going to return. However, typically what I see is that clients learn a lot about themselves in the process. In the 4 to 6 months they're on this medication, they typically have lost 25 to 35 pounds. And they're feeling really great. They're feeling motivated. They're feeling energized. They're feeling empowered, that they know which foods cause water retention, which foods cause weight gain, and they know which foods to avoid. Doesn't mean they can't eat those foods anymore, whether it be dairy or gluten or nightshade, vegetables, hot sauce, and all that stuff. Because who doesn't love hot sauce and who doesn't love pizza? But, you know, sometimes we have reactions. Some people will have reactions to these foods, and they just need to be limited within the diet. Because if you consistently eat things that are not good for you, it's going to snowball on yourself. It's going to cause insulin resistance from all the inflammation. And that's when people will lose traction after the diet. So if you learn that stuff about yourself in the process, we taper you off. We tend to taper people down off semaglutide, and it just makes for a better transition. Let's just paint this picture for a second. If you know in your mind you need something more to motivate you because you are just stuck in the mud and you're tired and you're feeling incapable of change, sometimes you need something like semaglutide to pull you up, to lift you out and help you go onward, and just empower you to make some of these decisions for yourself going forward. And so this is not a drug that you shouldn't condemn yourself or condemn anyone else for taking this medication. It is not the low road. It's not the coward's way to weight loss. It is simply a tool that you can use, and it must be respected. Now, if you're somebody who's out there and you're like, oh my gosh, that sounds really interesting, I wonder if that would work for me, just go ahead. There's a link in our description here. Go ahead and reach out. I'm happy to have a quick conversation with you about that and see if this program is right for you with our clinic. So if that's you, go ahead and click the link in the bio. And if you have any questions or comments, if this makes you mad or triggered, let me know in the comments. I'd love to engage with you. And if you like this content, go ahead and subscribe, like this video, and I will see you in the next one. Take care.